Russia has made the biggest announcement that all of us have been waiting to hear the entire year. We have a vaccine for the COVID-19. I'll be giving you a backstory and a lot of other information about COVID-19 throughout this video, so make sure that you watch the entire video till the end. First things first, does the vaccine even exist? Before we answer that question, I would like to share a few things about the COVID-19 or the coronavirus itself. COVID-19 is basically of two types, symptomatic and asymptomatic. Symptomatic is when you are fully affected by the COVID-19 and you are given the proper medication, you're isolated and you're put into the isolation ward. And asymptomatic is when you have the mild symptoms and you assume or think that you have the COVID-19, but when you're tested, you go to negative and you are not affected by the virus. And in this situation, they would keep you quarantined for 14 days, and it is highly recommended to be quarantined for 21 days to make sure that you do not have the virus in your body. Number 2. COVID-19 affects people who have a weaker immune system. For example, a friend's friend lives with a boyfriend and they cook the same food, they eat the same food, and they go to shopping together, they spend their time together. But unfortunately, the girl was affected with COVID-19, but the guy was unaffected and he was strong. And the main reason is because he just had a better immune system or a stronger immune system than the girl. Number 3. Dead bodies don't spread COVID. It was heartbreaking to see people abandoning their family members and their dead bodies just because they had COVID, and there was an assumption that they would also get COVID-19 if they brought the body home. Well, to be honest, when there's a death happening in a hospital, they would definitely sterilize the body before they give it to the family. And in case of COVID-19, all the hospitals are taking special care and they are going ahead and sterilizing the body before they could hand it over to anybody outside the hospital. And people tend to think that they might get affected by the COVID-19, which is not the fact. Anyhow, if you are getting a COVID-19 affected patient's dead body to your house and doing your funeral, make sure that you maintain social distancing, and as the usual ritual, make sure that you take shower before you touch anything that you use regularly. Number 4. COVID-19 is not a new virus. It might be true that China hid the fact that there is a new virus that is spread inside the country and they did not reveal it to the entire world until it started spreading. And this was the whole reason which led to a conspiracy and made the entire world think that China is starting a bio war. But COVID-19 exists and lives inside the bodies of the exquisite wild animals. Considering China's wide range of delicacy, it is no doubt that it must have been spread from any seafood or any wild animal that they consume. Now getting back to the vaccine. A university in Russia named Sputnik V University, which is located in Moscow, has been working on this vaccine. And before we get to the details, let's see how a vaccine is supposed to be produced. They take a few tests of antiviruses and they try different combination of drugs and try to arrive at a theoretical result. And once they have a theory, they would then manufacture a chemical or a drug or a vaccine based on the theory that they have. Once they have the vaccine ready, they would test it on a few volunteers. And once they are seeing a positive result on these volunteers, then they would go ahead and certify it as a vaccine. And the positive results are observed in a longer duration, let's say for 3 months or 6 months. After they have a positive result is when they would patent that particular vaccine or medicine and send it to mass production. Now that you know how it's done, let's see if Sputnik did something similar to this in terms of producing the vaccine for COVID-19. Sputnik recruited 38 recruits or volunteers to test this medicine on them or the vaccine on them. They were split into two different groups, a group of 18 and a group of 20. The first batch of volunteers were discharged on 15th of July and the second batch on the 20th of July. And all of these volunteers are going to be closely monitored for next half a year. And only when they're sure that this is not having any kind of a negative impact on the body and they're sure that it is completely safe for a human body to accept this vaccine, the developer would have to decide on how to proceed with the clinical testings going further. Russia alone is developing over 17 vaccines for COVID-19, and out of all of them, this is the only vaccine and the first vaccine that has ever been recognized by the WHO. So coming back to the question we had in the beginning, does the vaccine really exist? Absolutely yes. And to clear another misunderstanding, the vaccine is going to cure the patients that are already infected. Well, that's not the purpose of a vaccine. A vaccine is given to prevent the disease or the infection. So the let's say the patients who are already infected by the COVID-19 will be continued to give the similar treatment that they are getting right now, like the antibacterial and the antiviral drugs would be given to them, and they would be kept in isolation till they get cured. With this situation and the high demand in the market, Russia has announced a vaccine for the COVID-19 called the Sputnik V, or Sputnik Roman number 5. This vaccine has shown a positive outcome on all the clinical trials that they have, and it was created on a particular test platform which is not revealed for obvious reasons currently, but they say that this test platform has been used to create multiple other vaccines which are successfully building the immune system in the body for more than 2 years now. Russia has received over 1 billion orders or applications for the doses of this vaccine, and this was received from 20 different countries. Philippines also has revealed that they would accept the vaccine and use it on their patients in their country because they trust in Russia and their technology as well. Even with all this high demand, Russia is not mass producing the vaccine and not giving it to other countries, or not even using it inside their country. They're going to wait for the results after they finish their long-term tests or observations on the current test subjects or volunteers that they have. So to answer the question, if we have a vaccine for COVID-19, yes, but no as well. Because the only vaccine that we have is said to prevent us from getting affected from COVID-19 is not going to be mass produced till January 2021. And yet, not to forget, an important conspiracy that was going around, that all the governments in the countries or the world is hiding something from the public, so they are putting us inside our homes in the name of pandemic, which is not true because it is actually happening and people are dying all around the globe. So let's all stay home and only go out or step out only when necessary. With that said, I'm Manish, this is Mr. 6'2". Catch you in the next one. Bye bye.